Hey everyone, this is Dr. Anna here. Welcome back to my channel. And today's video I'm going to be speaking about the most discussed topic around the globe at this moment, that is coronavirus. And I have been getting requests from my friends to make a video on this topic, but I didn't want to make any attempt without having enough knowledge about it. So it took me a few days to gather few information which is right and legit, so that I can share it with you guys. So let's begin. Before I start this video, I just want to tell you that I'm not an expert on this video. I'm still a learner, but I have tried to gather all the information present in the video from genuine sources like WHO and other health related sites, and not from social media. This is not an educating but an awareness video, so that I can spread awareness among my friends and family about the condition. And being a healthcare professional, I think it is very important in our field to follow certain protocols to stay safe in this period. What is coronavirus and how does it look like in microscope? So coronavirus is a large family of viruses which can cause illness in human as well as in animal, and which can range from simple cough and cold to severe respiratory diseases. And in the microscope, the virus is shaped like a tennis ball with the spikes on the surface of it, giving it a crown-like appearance, hence the name corona. So depending on the type of spikes, the virus attaches to certain place in our body. For example, if a particular virus has a spike which attaches to nose, then it will cause common cold in a person. And so if at all the virus gets inside our lung, it gets attached to our lung and it has tendency to multiply inside the lung. And this is how the virus uses our own body to make more viruses. So where did the virus come from? So the disease was first originated in Wuhan province of China, in a local fish market where they used to sell live wild animals, and apparently these wild animals carried virus. And the disease was first reported in China last year in 2019 on 31st of December. So how is this condition is affecting different countries around the globe? As WHO have already declared this condition as global health emergency on 30th January 2020. There are several death reports coming from, around 213 death reports coming from China, and around 1,000 of people are affected already. And there are no death reports from other countries, but there are positive cases from other countries like Russia, Britain, Italy, and also in UK, US, Vietnam, and not forgetting our own country, that is in India. The first report was from Kerala. A student from Wuhan University was who had traveled to Kerala recently was found positive with this virus. He was been tested with 23 other students, but all of them were negative, and he was found positive. So what is global health emergency? It does not mean that you have to panic when you hear this word, but it is basically a wake-up call for all the other countries, so that we can unite and fight together against the disease, because China cannot stand alone in this situation, and it needs global support from all the other countries to fight in this situation. So the common symptoms associated with coronavirus infection is fever, headache, cough and cold, shortness of breath, and chest pain. It mimics flu, and in severe condition it can lead to acute respiratory distress, pneumonia, and death. So how does the infection spread, and what is the incubation period? Since it is a zoonotic infection can be mainly transmitted from infected animal to human. Human to human transmission can also occur mainly by airborne particle, surface particle, or by close contact with other infected person. And the incubation period of this virus is mainly 4 to 14 days. The incubation period is mainly the time period between the first exposure with the infection till the first symptom arises. So how do you tell that if you have got coronavirus infection? Just by looking at the symptoms, you cannot just come to conclusion that you have got coronavirus infection, because the symptoms with coronavirus infection closely resemble symptoms with flu. So you need to know that you need to have recent history of travel to China, or you need to have recent history of close contact with someone from China, or with someone who have already got the disease. So is there any permanent cure for this disease? No, unfortunately, there is no permanent treatment to cure this disease, but researchers have been working on finding medicines and also vaccination for the disease, and I hope by couple of weeks or by months we will have a permanent solution for this condition. As I said just now that we do not have direct treatment for the condition, but we need to follow certain supportive measures. Like if a person is dehydrating, we need to put the person in IV fluid. If a person has fever, we can give him antipyretic drug, and if he's coughing, we can give him cough syrups and other drugs. And if a person is having breathing difficulty, we can put him into ventilation. What are you supposed to do if you are doubtful that if you may have infection? You are immediately supposed to go to your doctor. So I have put a few preventive measures here. So the first one is, do not panic and get your facts right. Do not believe in false sources. There are many sources in social media which is trying to scare people for their own advantage, but do not fall for it. And before believing anything, make sure that it is coming from genuine source. Do not travel to China until and unless it is very important, and I don't think there is something more important than our own health, right? Wash your hand frequently. A good hand hygiene is very important during this period. Wash your hand with soap and water, or you can use any alcohol based hand rub. And when you are coughing or sneezing, please do it on the tissue and throw it out. The next is avoid close contact with anyone. So this is a universal precaution, and it is better that please do not shake hands in public, because this is the time where you have to be very careful about everything, whatever you are doing. So if you meet someone, please say hi and do not go and shake hands. Do your best to keep a safe distance from someone who is sick. If you see someone who is coughing or sneezing, please do not go near them, or do not stay with them for a long period of time. The next question here is whether wearing mouth mask will help. Yes, you can wear mouth mask. At least it will prevent you from touching your face, but it will not completely prevent the infection from spreading, because the mouth mask which is available commercially is not as protective as surgical mouth mask which doctors use during surgery. Regarding eating non-vegetarian items, I haven't found any article or any relevant source which says that avoid eating meat or animal product as such, but it is always better to be safe from our side. So you can eat, but please thoroughly cook before eating. Do not take any cold or flu symptoms lightly. Even though if you don't have this infection, please do not take any cold or flu symptoms lightly, because by doing this we can prevent this infection from getting severe and from spreading it. So this is it for today's video, guys. I hope this video was useful for you all, and any new update on coronavirus I will be updating on my channel. So if you like this video, please don't forget to like, share and subscribe. I'll see you in my next video. Until then, take care. Bye bye.